There was a buildup that eventually brought about an event that me nor my family or friends would have ever thought or imagined would happen to me. In my head, I was believing that at 62 years old, my time was done. I even rationalized that the absence of the body is the presence with the Lord. I had a nice life insurance policy that would protect my family. So when you look at being a protector and provider, I was covering all those. I was doing the check marks. And I was going to do the silent death, carbon monoxide poison. I drank a bottle of wine, and I went to a place, parked my truck. I had Christian music on the whole time. I had failed to turn my phone off. My daughter called, my brown-eyed girl, pleading with me. And I kept saying, Jesse, it's best. They were able to get the police department to triangulate my phone. And God sent an angel in a police uniform. He put me in the back of his cruiser and all the way to the hospital. He shared with me about his family, and I share with him about mine. So at the hospital, they put you on a watch. After I was interviewed by the psychologist there, she said, "Did you really want to die?" And I said, "No, I wanted to live." And I volunteered to go to the ward. So the second day, I'm chatting with my psychiatrist. In his mind, I was just severely depressed. And I actually asked him to chat with my wife, who is a professional counselor. She said, "Doctor, you haven't seen his manic side." He changed his diagnosis to bipolar 2. I have confirmed since that time, almost 3 years ago, through a 98-year-old aunt, that what is now called bipolar, that was called manic depressive, has run in my family for years.
Mental illness is so common. Lots of people are walking around with it. Lots of people love someone who's walking around with it. And basically, we all interact with people who have mental illness on a daily basis. So we can't afford to ignore it or to pretend like it just affects a small number of people.
So bipolar disorder is a mood disorder that is characterized by both periods of depression and then periods of an elevated, expansive, or irritable mood, such as hypomania or mania. Not just depends on genetics, but it depends on the environment and what stressors can play a part into the manifestation of the illness.
I had no idea until I was diagnosed how dangerous manic really is. For when you're manic, your state of mind has been hijacked.
The scary thing about mania is that the person who has it's like the last one to get the memo. So I didn't really understand what it was doing to my marriage.
I was done. I was done in the sense that I was just exhausted, mentally, physically, emotionally. There was a lot of things that had happened for Jim and I in our relationship. A lot of wounds, a lot of things that had been said that were hurtful.
That mania started out as just the hypomania in the very beginning that was so subtle not even I could notice it. But over a 6-month period of time, I went from about 205 pounds down to 165. Very productive at work, had all these ideas that were swimming around in my head. I became so manic that I was spending lots of money and became very verbally abusive with Beth.
In the year prior to 2007, his diagnosis, he was misdiagnosed. Definitely diagnosed with depression, but he was put on some medication that was the wrong medication. And so for a year, it escalated him from not being depressed to being more manic. I think for me, a lot of times if he was not depressed, it was a great thing. I was so happy that it wasn't, that I don't think I saw the other upswing of it that he'd probably been going through for several years.
Beth went to my psychiatrist and said, something's not right here. And she started explaining what my behavior had been like over the previous months. And she said that he literally turned white as a ghost. And he looked at her and he said, I don't think Jim has depression. I think he has bipolar disorder. I remember immediately going to my computer and Googling bipolar disorder. And as I started reading the symptoms for the first time, I said, wow, I feel like this really explains me.
What goes up must come down. And the thing is, nobody can predict when you're going to leave manic and head for depression.
When I'm in that dark place, when I'm not well, the irrational thoughts take over and they consume me. It plays into my insecurities that I'm a bad person, that I'm a bad mom, that I'm a bad wife and friend. It's really hard to go through years of trying to find a diagnosis and find doctors that you are comfortable with. So I was diagnosed with depression, but I kept having these episodes. A friend was seeing a doctor and things seemed stable in her world. So I said, why not? Let's try. And that doctor did 3 hours of cognitive and behavioral therapy. And he came in and he said, I think you've been misdiagnosed. And I looked at him and he said, I think you have bipolar type 2. And all I could think of was, I had seen bipolar, the mania, in an extended family member. It was incredibly destructive. It ruined relationships around that person. So that's what I have? And he said, no, you have less pronounced criteria of mania, but you're like a ticking time bomb. And if you don't get help and treat it the right way, it's gonna go off. My husband was referring to the illness as sort of like a radio station where you are fine-tuning the dials and stress might come in and it might mess with that a little bit. So you twist it and you turn it, but ever so slightly, because I've realized that frequency that's healthy.
The nature of mental illness and society's relationship with mental illness causes a separation. 26.2% of the American population, 18 and over, will have a diagnosable mental disorder in any given year. Mental illness is far from a fringe experience. It's very, very common.
You surely would have seen me as a teenager and saw that I had problems. But those were all just kind of chalked up to, trauma and abuse. I got into some really bad crowds. By the time I was 11, 12, I was smoking cigarettes, became sexually active, was doing drugs. I found myself teenage mother, 16, 17. When I was in high school, we used to actually use bipolar as like a way to tease each other. Like when somebody had a mood swing, like, oh yeah, my girlfriend, she's being bipolar today. It was just a synonym for crazy to me. Like, I didn't really know what it meant or what it looked like on people. It wasn't until years into my counseling journey that I began to see some signs of mental health. I found myself in the hands of a really good psychiatrist, and it was the first time that I was diagnosed with bipolar 2, and it was scary. There was a lot of barriers. For one, when my husband and I began to seek counseling, we couldn't go to the inner city. We didn't find places in our neighborhood.
The mental health system can sometimes be sicker than the patients that we treat. And that is because it's so fragmented, it's so hard to know how to access help. How can we expect the people we treat to be whole if the system isn't? But that's why it takes collaboration, and it takes all of us working together for different populations, different people, different socioeconomic statuses, so that people can get the help that they need, and so that we can unify.
But people tend to be so afraid of mental illness because they can't see it and they can't explain it and they don't understand it, that they tend to want to push away from it. They don't want to be around it. They want to go in the opposite direction.
What someone looks like when they're very ill and what they look like when they're stable is night and day. And you wouldn't even think they were the same people. And so it really shows just how successful folks can be with the proper treatment.
You know, it's different for every person of what they need as their regime to be compliant and stable.
You know, medications, I sort of say it's about 50% of a wellness plan. For me, it was exercise. To make sure that it happens, I scheduled it in my day. And then sleep. The great thing about tracking my sleep is if I see that I haven't gotten enough rest for 3 or 4 nights, I know if I don't kind of get the train back on the tracks, I know where I'm headed. I'm headed into a depressive episode more than likely.
I know that my platform, until the Lord takes me home, is to break the stigma, especially first with men who don't want to share their story.
There's something beautiful and something empowering about that, to know that you're not the only one. And that's why we need community. We can change communities just by letting other people know, hey, me too.
People who have mental health problems are already in every church. So you can create a church where it's not safe to have that problem. Or you can create a church where it is safe to have that problem, and we can bring some hope to that situation, and we can move forward, and we can maybe even bring some healing to some of the people who are experiencing these challenges within the church.
There is research that shows that African Americans and minorities are coming to counseling, and that they are more willing to come to counseling than they've ever been before. So I believe that mental illness is being destigmatized, that the stigma is getting better.
The more that we can normalize these conditions, the more people will feel open to getting help, and the more lives we can support, and the more suicide attempts, the suicide completions we can avoid.
I mean, it is a journey. There's so many things in life that are difficult. I think this is one, but I think a lot of the great things in life, and especially in our faith, I don't think they are easy.
A mental illness diagnosis is not all of who you are. It might feel like that in the beginning, but it's really not. I'm an artist, I'm a writer, and I also have bipolar disorder, and that's okay.
I am not bipolar. That would be no different than someone with diabetes saying, I am diabetes. Well, that's not the case. The person with diabetes has a condition called diabetes. I have a chronic illness called bipolar. That is not going to define who I am.
I still struggle. I struggle with my bipolar diagnosis. I struggle with sometimes not wanting to take my meds, wondering, am I really crazy? I still struggle with depression at times. I still struggle with being manic sometimes. And that's okay.
Praise be to God for intervention of an angel in a police uniform, of a floor, a ward for 4 days. Our darkness, whatever that darkness is, through testimony can be someone else's ray of hope. And every time we tell our story, it brings healing to our soul.